After finishing the ABG, I would make sure that I note the patient's position, their activity body temperature, depending, their FiO2 or liter flow, depending on if the patient is on something that gives him an FiO2 or a liter flow, like a nasal cannula or vent settings, things like that. And then I would also dispose of my equipment, so I would make sure my needles get in the sharps container, and I would make sure I remove everything from off the patient's bed. I wouldn't want to leave anything there. And then I would go and run my ABG immediately, and in the medical record I would record the time, the date, the temperature depending, the Fi2 or the liter flow depending, as well as the puncture site, the position of the patient, the respiratory rate, the SpO2, and the Allen's test, the modified Allen's test. And so I would record all of that, and then I would be done. I would also go and notify the correct personnel, the appropriate personnel, with the results of the ABG, which would most likely be the nurse. Alright, just a quick clarification. In my video, you saw me push my syringe here to get the air bubbles out with my thumb. This would be the correct way of doing it, pushing it out with your ring finger, just to make sure that your thumb doesn't go all crazy and squirt too much out. And then, when I said I'd put the sticker around the needle, I meant around the syringe, because I'm not keeping the needles, I'm putting the needles in the sharps container, but I would put it around the syringe with all the information on it.